Good evening, everyone. My name is Pearl, and I'm here to share my story as a nurse. I've been a nurse now for about a year and 8 months, to be precise, and it's been rewarding so far. It's been challenging, don't get me wrong, but overall, the benefits have definitely outweighed the risk. So, I'm going to answer some questions here. And the first one is, what led you to choose nursing as a profession? I mean, I come from a family of nurses. My mom is a nurse. I have three aunties that are nurses. My deceased grandfather is a nurse. My deceased auntie is a nurse. My godmother is a nurse. So, I mean, I'm just surrounded by great nurses and great people. And it motivated me to follow the same path, to care for people, to be compassionate, and just do what they've done. Also, nursing affords me the opportunity to follow my passion, which is to make an impact in the lives of people. And that is really, really my biggest motivator to choosing this career. And also, honestly, nursing also affords me job security. I mean, there's a projected shortage of nurses in the nearest future, and being a nurse is, it's a job that is secure. You're very sure that you're always going to be at work, and with job security comes financial security. The next question is, what has been your worst and best day so far in your career? My worst day was the day that my transplant patient fell. This patient had complicated cerebral encephalopathy, intermittent confusion, and we have been guarding him like an egg. We have been protecting him because our kidney transplant patients are they're very, very precious to us. Every patient is precious to us, but that is our specialty. That is what the floor is known for. So we have been protecting him, and I went for lunch and they came and called me in the break room that he fell. Apparently, the family member turned off the bed alarm, so we didn't know how it happened, and all we had was, a heat on the floor. I mean, I felt like I had disappointed my patient. I felt like I had disappointed myself, and it really hurt me so, so bad. And that day, I consider my worst day as a nurse. My best day was the day I took care of. It was an elderly patient. I took care of him 3 nights in a row, and on the last night, he told me, "Go home and have it in your mind that you have taken care of an old man and that you have helped an old man today." I mean, those words really touched me, and I mean, my heart melted in that moment. It was just an epic moment for me, and coming from him, he took it to the next level. I mean, being appreciated, it reminds me of the reason why I really chose my career and I chose to be a nurse. And I mean, all I can say is that day remains the highlight of my career so far. The next question is my faults and my attributes that make me who I am. I mean, my greatest fault that I know so far is that I'm quiet. And I mean, that is a fault to people, being too quiet, or you don't talk a lot. But to me, it gives me, it's also an attribute to me because it allows me to be able to think more. Because when you're quiet, your brain is working, you're thinking, and it makes me more calculating, it makes me more attentive, and it just makes me a more thoughtful person. I mean, it also helps the words that come out of my mouth. So, before I say something, I have thought about it, I have processed it, and I mean, it doesn't guarantee that you're always going to say what is right, but it just, it makes me a better person. it's a fault to some people, but it's an attribute to me as well. An attribute that I would say that I have is active-minded / attentive. So I move around and I pay attention to details. I pay attention to the little details around me. It's more like a photogenic brain, where you just don't pass by. You pass and you listen, you see, you hear, and you just take notice of things. It helps me even with taking care of my patients, because when I step into the room, I'm glancing around, I'm looking around, I'm trying to pick up signals, trying to pick up things that are going around. So that is an attribute that I associate myself with. What are some of my challenges in my position so far? So far my biggest challenges would be working nights, keeping up with the sleep cycle. My circadian rhythm is just off. Working nights and then coming back and having my off days. I have to revert and then revert back when I have to go back to work, so that makes it hard. Other challenges that I face are the nurse-patient ratio work. It's a challenge because sometimes the ratio is just, in addition with the acuity of the patients, it's just impossible for you to provide optimal care. You're going to provide the basics, you're going to give medications, you're going to do all the required things that you need to do, but to provide optimal, satisfactory care is going to be difficult, and that is a challenge because that is our goal every day. My goal going into work every day, my goal is to make all my patients happy, is to provide the best quality care that I can give to them. So it's really a challenge not being able to accomplish this every day because of the nurse-patient ratio. Another challenge that I face working is, having to be assertive without being misinterpreted as being rude, especially with the CNEs and other ancillary staff. That's a challenge because you don't want to be too weak, so to say, and it's just finding that fine line between assertiveness and stepping on other people's toes. The next question is, provide a positive statement about your career. All I can say is nursing is a calling that has a higher purpose attached to it. Sometimes you can't really see it with the mere eyes. You have to have the understanding to be able to grasp what nursing is and what it really means. It provides personal satisfaction, and that is why patients in America and also all over the world view it as the most trusted. Maybe not all over the world, but in America it is viewed as the most trusted profession, and it is highly respected all over the world. It's a respected field. It's a flexible field. You're able to switch things up and still have a family and still do this job. It's considered the heart of the hospital, because without the heart, the body can't function. Without nurses, the hospital can't function. It's ever changing, it's ever growing, it's ever expanding with the help of technology and medicine. It is evolving into something greater and greater and greater every day, and I am proud to be a nurse. And to say 10 descriptive words about myself, I would say that I'm a compassionate person, I'm a hard worker, I'm professional, dependable, I'm attentive, knowledgeable, I'm positive, I'm emotional, I'm very funny, and I'm a team player. So thank you for watching my video, and I look forward to seeing yours, and I hope you enjoyed this video. Have a good night.